Hello, my name's Tim, and this is the first video in our mini-series on suturing. So in this video, we're going to go over indications for suturing, types of sutures, the equipment you'll need, and how to perform simple interrupted sutures, which are the commonest stitches you'll need as a non-surgeon. Keep an eye out for our other videos on horizontal and vertical mattress sutures, purse string sutures, and hand tying, if you're feeling like heading straight to level 2. The first thing to say is this is not a wounds video. However, as an orthopedic trainee, I must mention briefly that sutures should be used to close clean wounds. You never close over a dirty wound. That just shuts the badness inside and causes a whole host of bother. A dirty wound needs thorough debridement and irrigation. In essence, if you're not sure whether to close a wound primarily, make sure you run it by one of your seniors. You'll hear a lot of the bosses say, the solution to pollution is dilution. There are also a lot of materials available in your arsenal, other than sutures, should a wound need closing. You don't need to dive straight for those sutures. Remember that in order to suture, you'll need local anaesthetic, as suturing involves repeatedly stabbing someone with a needle. It's not always ideal, especially, say, in children. Suturing should be avoided if you, or your senior, think you may be better with, say, glue or steristrips. Again, make sure you run your closure decisions by a senior. So, what is a suture? A suture is essentially a medical needle and thread, used to close a wound, meaning that you're approximating the wound edges, allowing them to heal. It also helps stem any bleeding from those skin edges, and also reduces the potential space for infection. There are lots of types of sutures, so let's go through a few of the terms you'll hear around types of suture. First up, absorbable versus non-absorbable. This first pair, they're relatively self-explanatory. There are certain wounds in surgery where you'll want absorbable sutures, and some where you'll want non-absorbable. This doesn't just apply to wounds on the skin surface. Depending on what you're suturing, you may want to use non-absorbable sutures on, say, vascular anastomoses, or alternatively, absorbable sutures if you're just closing the fat layer on your way out. Whenever you're choosing a suture, you have to be mindful that you're implanting something that will cause a tissue reaction. And in some situations that might be handy, i.e. if you want to induce some scarring as part of the healing process, but there are some tissues that are just less tolerant to that. Absorbable sutures are broken down by the body at different rates, depending on the type of suture, ranging from breakdown starting after a few days, all the way up to a number of weeks. Common absorbable sutures you'll hear about are monocryl, vicryl, and PDS. Non-absorbable sutures are perfect if you need the suture long-term internally, or want to remove the suture in its entirety after a set period of time. Inside the body, they tend to be used in gastrointestinal surgery for bowel anastomoses and vascular surgery for vessel anastomoses. The main time you will see non-absorbable sutures, though, is in skin closure, and it's what you're going to reach for most often when you're closing a wound. Common non-absorbable sutures you'll hear about are ethylon, prolene, and silk. Braided versus monofilament. So, braided versus monofilament is the next way you can classify sutures, and again, it's pretty self-explanatory. A braided suture has multiple strands and is therefore stronger, and the extra friction helps the knots stick. Just like comparing tying your shoelaces with tying together two pieces of plastic cable. It is rougher though, and so it's harsher on delicate tissues. Monofilament sutures pass through tissues a lot easier. In real life, vicryl is a braided suture, whereas ethylon, prolene, or monocryl their monofilaments. Natural versus synthetic. Most sutures these days are synthetic, it must be said. They're made of man-made materials. However, there's a few natural materials still used, especially silk, and this is commonly used to suture in drains or lines. Catgut, the original suture, it's rarely used these days. So, sutures can be absorbable or non-absorbable, braided or monofilament, and natural or synthetic. Whew. I'd recommend having a look at the wall of sutures that's in every theatre, and you'll see a range of materials from fine monofilament clear sutures all the way up through to steel wire. Make sure you choose the right tool for the job. So what about the size of the suture you're using? There's kind of a lot of numbers used here. Essentially, it's a scale, which starts with whole numbers, and then when it gets to 0, it counts back up again, and there's a 0 after it. i.e., 5, 4, 3, 2, 1, 0, 20, 30, 40, 50, etc, etc, etc. So initially, 0 was the smallest suture they had, but then as surgery progressed and the ability to make sutures progressed, things got smaller and smaller and smaller. The way to think about it is 20 is actually 00, and 30 is 000, and so on. A wider suture is obviously going to be stronger, but it's probably not great for closing a facial wound if you're really looking for cosmesis. As a general rule of thumb, most general skin wounds, you're going to go for a 30 or 40 suture, and that'll be absolutely brilliant. However, it's not uncommon to see, say, facial wounds closed with much smaller sutures if the plastic surgeons are involved. And, say, large quadriceps tendon repairs, they need a size 5 suture. They need to be pretty strong. What about the needles? So most needles you'll see are curved, as they're designed to be used with a needle holder and pass through the tissues carefully through the radius of that curve. However, you may come across surgeons using straight needles which do not require a needle holder. They look like conventional sewing needles. Be careful with these though, as there's less between you and the sharp thing, and most surgical skills programs and surgical training programs will advise against these. They'll likely be phased out with time, I suspect. There's more to types of sutures than initially meets the eye, so if in doubt, ask someone. But generally, again, for skin closure, you're going to be looking for simple interrupted suturing, and you're going to want a 30 or 40 vicryl, prolene, or ethylon.